Hello, my name is Clive Gallagher. I am a plastic surgeon based in Indianapolis, Indiana. Today's question that I'm answering is for our transmasculine patients who get top surgery. And a question I get a lot from these guys is, will I get dog ears after my top surgery? I would say the answer to that really depends. First of all, full disclosure with our patients, I would say probably about 10%, maybe a little bit less of our guys get some sort of revision. And I would say typically it's because of a dog ear. What is a dog ear? That is a little puffy piece of skin, usually. Sometimes some fat is with it that kind of sticks out around the patient's sides, usually at the sides, but you can also actually get it in the middle as well. The chances of getting a dog ear usually go up the bigger you are, that there's more skin to get rid of. So if you wanted to predict, am I going to get dog ears? First of all, I can tell most patients what the risk is for that. But I would say if you're at home just looking in the mirror, first of all, take a look and sort of see what the shape of your chest is. If a lot of that breast and tissue tends to go and wrap towards the back, the chances are you probably are going to get one. In some guys, we'll see that tissue will wrap right around the back. And so what we'll do in that situation is usually try to make a smooth transition. So you still would have that fullness at the side. It doesn't matter what your gender is, you would still have that. But instead of looking like a shark has bitten you and you've had surgery and you have a big pointy dog ear, we tend to try and smooth that out. And most of the time that works very well for guys. If it doesn't work well, we can always, I always say it's up to the patient. We can always go back and sort of turn the patient on their side or even on their belly and get rid of the rest of the tissue as it extends around the back. If you do need dog ears removed, there's two ways of doing it. We can do it in the office if it's just a small piece of skin. We can take it out as long as needles don't bother you too much. Or it can be just a quick 10-minute surgery where we just take out the little pointy bits of skin, put everything back together, and take it from there. So dog ears are not by any means the end of the world. Oftentimes folks will have dog ears in the first few weeks after surgery, and it's just a matter of letting all that swelling go down and letting things get better. So those are some pointers to predict whether or not you'll have them. Also, it's really important to see your surgeon's before and after photographs. If you're seeing dog ears all over the place, well, maybe you're at a little bit higher risk of having them with that particular surgeon. So it's a great question. It's something to ask your surgeon about, and I hope this helps.